Welcome to Behavioral Health Today, a Triad production. I'm your host, Dr. Graham Taylor, and today I'm joined by Dr. Ragan Schriver. Ragan is an associate professor of practice at the University of Tennessee College of Social Work, where he teaches clinical and leadership courses. He's also the director of the MSSW program, Knoxville campus, and the chair of the Forensic Social Work Certification Program. He's created as well a certification program in trauma-informed care through the University of Tennessee's College of Social Work. In addition to his work in academia, Ragan also serves as the special assistant to the, let me go over that again. In addition to his work in academia, Ragan also serves as the special assistant to the president of the Catholic Charities USA to develop integrated health programs within their network. Ragan, welcome back to our show.
Thank you, Graham. It's great to be here.
It's really nice to have you back. For those listeners that are just joining us today, Ragan was on our show before talking about his program that he developed and he teaches, the Trauma-Informed Care. Really great show, really terrific program, and some really great aspects that he covers around trauma. Very informative, very educational. So I encourage you to go back and take a listen to that. Today, we're going to be talking about trauma again, but we're going to be doing so within the context of our Clinicians series, where we like to go deeper into the therapist-patient experience. And what we want to do in this series is work to give our listeners an understanding of what occurs within the therapeutic process, kind of behind the proverbial closed doors of therapy. But we want to give you an understanding of what goes on for the therapist. We're going to try and speak very vulnerably and very transparently what we think as therapists at times, what goes on for us, and what we experience with the people that we get really the privilege to work with. Ragan, as we start out today, what I'd love to hear is, in our first show, you had really a wonderful analogy for us of what trauma is. And I'd like to kind of just start the show today with giving us a cornerstone understanding of the definition around trauma. Can you give us that?
Yeah, for sure. I just am excited to be able to talk with you all, and also just to kind of say that I'm standing on the shoulders of giants. At the University of Tennessee, we have some great folks that have put so much implanted some knowledge into me and an understanding of stuff on the area of trauma. And so I'm excited. I just want to kind of give a little shout out to those folks because
that's awesome.
Maybe they'll listen.
That's good.
But I think that when I think about trauma, I know there's so many discussions and concepts of what is trauma, and there's definitions that I know like the APA has put out and the NASW sort of talks about what these trauma is. And I think sometimes I feel like that there's this focus on the individual, I'm sorry, not the individual, but the external experience. That the external experience is the trauma. So then therefore we categorize things as a flood or abuse or something that external thing is the trauma. But really what we're coming to understand is it's more of the person's internal experience. Mm-hmm. So I kind of came up with this analogy that we as human beings have this system that's built inside of us that could be analogous to, like I live in Knoxville, Tennessee, and we have a great sewer water removal system. It's probably not the thing that you would lead with, or that the the community's using as their headline. But when it rains here, the water system takes the water off the roads, and there's the sewer system that just removes the water. So when a normal, typical rainfall comes, the sewer system that we have in place removes the water, and everything can be okay. Analogous to the system, the nervous system that we have as human beings, that when daily stress comes about, we can handle it. There's this typical stress response that we have that we can respond to, and it's resolved. There's maybe the stressful, we have to take a test, or our boss asks us to do something very stressful, but we deal with it and we respond to it, and then it resolves in our body, and we're okay. But then sometimes here in Knoxville, there might be a big, huge flood, a big rain. And so then the water system becomes overwhelmed, and then the water gets backed up, and then there's damage on the roads. There's, some of the earth kind of shifts around. Maybe a home might get shifted off of its foundation. All these things that happen because of this flood. And then the system becomes overwhelmed. But then over time, still there's sort of an impact that's been left on the roads or on the ground or on that home that's been shifted off. There's still that impact that's there. And I think that's sort of, again, analogous to
Yeah.
our nervous system, that sometimes big things happen to us and overwhelms our nervous system and our ability to be able to cope or to deal with it. And it leaves a lasting imprint on us.
Amen.
So then we end up with this imprint on us of these traumatic events or traumatic things that are sort of the flood that's overwhelmed our nervous system, which is the stress response system.
Yeah, I think that's a terrific visual and a great picture of what happens. I like what you're saying. It is an internal experience. You don't see it on the outside per se, and we know that it does, cause kind of a unique wiring and kind of sets off certain things in our mind. We know from MRIs that you can kind of see those traumas get lit up when someone's in that state and activated. And you're talking about how that flooding occurs and it shifts things and it doesn't get processed. I like to think sometimes that trauma is an experience outside the realm of normal experience, where we don't have the ability to understand, process it, deal with it, cognitively, the way you're saying, and it actually does leave some things really kind of in a different state, doesn't it?
It really does. I feel that, just to continue the analogy, I think about, maybe I talked about this a little bit the last time, but the idea that when that flood comes, I have to, the community has to adapt to where the
Yes.
road is broken, and so then I have to find a new route to go
Yeah.
around, and I adapt because during this traumatic experience of the flood, I've adapted my life to that.
Yeah.
So if I think about, if I have been if there's been some sort of maybe sexual assault or physical abuse
Yeah.
or whatever sort of traumatic experience that my body experiences as negative, I'm going to adapt to it. I'm going to adapt my life or my patterns of behavior or my pattern of
Yeah.
thinking around that. And sometimes those adaptations in any other setting would not be adaptive.
Yeah.
So then I'm living my life in this way that may be still oriented around this traumatic experience, but I'm
Yeah.
still behaving this way, if that makes sense.
It makes total sense. What I really like about that too is that those things that once helped us survive and manage the abnormal environment we're in, these are really good adaptations to that. However, those adaptations become problematic later on, don't they, in our lives, whether it's about trust or interpersonal relationships. We're going to talk later in our show today, and I'm really excited about this part of how we use a therapeutic relationship to work through some of those maladaptive, well, let's put it this way, those adaptive abilities that now are maladaptive interpersonally in their adult life when they're no longer necessary, but this is the only roads that they know how to go down.
For a few years, I worked at an eating disorder unit that treated persons that had anorexia and bulimia specifically. And I feel like that the adaptation of the diet to either extreme starvation or binging and purging became that adaptive way to try to handle this stress or the trauma or the experiences of their life. But then it almost became intimate to them, that this adaptive at the
Yes.
time behavior became so intimate to them that we almost kind of like it was a friend. I know that sounds extreme, but
No.
this close thing or a friend that they had, that it was very difficult to let go
Yes.
of. So
Yeah.
sometimes those adaptive behaviors that have become maladaptive are so tough to change because our
Yeah.
body just gets used to it and wants that, whatever that is.
And as you're describing this too, we get to be reminded that these are formed unconsciously. We don't know we're doing this. This is being done without our awareness. And now you're telling me the only way I've known to live my life safely, you're telling me is no longer the right way to be living my life.
Mhm.
And my first thought is, are you crazy? I'm not going to let go of this friend. I'm not going to let go of this way of staying safe. And I know no other way. I have no other model than the way that I see the world in this way. Let's hold that. We're going to come back to that a little bit. I want to maybe shift into this, while we need to be in this work, well trained, the schooling, the supervision, the licensing process, the competencies that we are required and need to have in order to be effective in this work. I really believe that we are our own greatest tool, though, as therapists in the therapeutic process, where we get to use ourself consciously, intentionally in that therapeutic relationship. How do you encourage your students to think about becoming aware of themselves, their own upbringings, maybe their own personal traumas, such that they're able to do that work so that it doesn't interfere with the things that they're going to be sitting in front of and hearing, so that they can kind of be in that place themselves, to be that vessel to hold these things. How do you encourage that?
It's something that I feel like I constantly kind of talking about with my students, and I feel like I have to be honest and say that I sort of draw on my own experience. I think as a teacher to students, it's a little bit of a different boundary. That maybe I might share a couple things about my own experience, not too much, but just enough so that maybe that they could connect that to themselves. I know for myself that I feel like that for part of my career, maybe I maybe was afraid to look at things in my own life or
Sure.
address something in my own development, and so it became sort of I'm holding my hands up in front of my eyes, like because I became blind sometimes to something that was going on in a client because I flat out didn't want to address it in myself.
Right.
And so I was doing a disservice to the client because I was doing this maybe a thing that had been adaptive to me even at one point of not looking at this issue, whatever it was. And so then therefore, I think it impacted the therapeutic relationship. And so, hey, students or anybody that's listening,
Yeah.
this thing that we're doing, we're not going into to a thing where we're making widgets. The use of self is the essential part of this process. So I remember being a little bit frustrated thinking, why am I not making progress in some of these situations? And I had to look hard at myself. And I mean, I have to say it wasn't easy. And I'm still trying to figure it out as we
Sure.
all are, kind of thing too, you know?
I really like that. You say that in those moments when, if I haven't done my own work, one of two things can happen, maybe almost two sides of the same coin. One, if I'm with somebody that needs to talk about something that I haven't worked through, but they need for their therapeutic process to continue, I may not want to go there. And unconsciously, I'm directing us in other directions. Or if I haven't done my own work, I'm going to do it vicariously through them in a way where they may not be ready to go down that path, but I might be beginning to push in ways that is premature for their readiness to take a look at it.
Wow, that's I love how you coined it as said two sides of the same coin. I think that's a terrific point to make.
Yeah. So what you're saying, without our own work, which I would encourage all students, and I think even as therapists, our ongoing work, if we're going to be our best tool, let's make sure that, we're doing that work so we can be kind of present in that way. What do you find, um, just to our listeners? Rick and I had an opportunity to talk earlier this week, and we were talking about, ideally in our show, he and I get to model what we hope all of our colleagues get to do with somebody in their life. And that's work to a place where they can speak honestly and candidly. They can be transparent with one another. It's hard sometimes to say, hey, man, I had this thought in therapy. Can you believe I had that thought? Or this came up for me and I got triggered in this way. And if we can find a place and a person or persons to be able to open up this way, this is where we become our best tool. And part of what I was talking with Ragan about, and what he was encouraging us to do in this show, was to kind of model some of that, where we're talking about things in a very honest and candid manner. And so I guess my next question, and I'm going to jump in on this and try and be as transparent as I'm asking you to be, Ragan, but around, what are some of the tougher cases that you find being most challenging for you? Some of the presenting problems that are hardest to deal with?
I think I have a couple of thoughts about this. Two cases immediately come to mind. One is kind of humorous. The other is a little bit more painful. The one that was sort of humorous. So I was brand new. This was years ago. I was brand new, working at an alternative sentencing program with folks that had some sort of influence with the justice system. So it was a men's group, and there were 10 guys that I was leading this therapeutic men's group. And I took to heart the thing about boundaries. You keep your boundary up, and that you don't let people, all that kind of, the boundary thing was just very big. So the group was a disaster. I wasn't being very real. It just wasn't very, I wasn't in relationship with them. I was sort of like providing some sort of service. Like I was just doing what I read in the book rather than really utilizing myself. Well, one day I went out to the car to get something, and all the guys were out on the front porch having a smoke before the group. And they said, hey, Ragan, come on over. And I thought, oh no, I can't talk to them. This is a boundary. It's outside the session. What am I going to do? And so I went over and I said, okay, well, and I went and talked to them. Well, I didn't reveal my deepest, darkest secret, but I sort of talked to them as a real human being would.
Yeah.
And then I have to say, in that moment was a big breakthrough for me. Hopefully it was for them, but like we went in, we had a group. That group became more successful
Mm.
because I think that I just thought, okay, you're trying to be something that you're not, Reagan, and like just be you. Not that I'm like pouring out all my issues, but
Oh,
like
I
I'm
get
just
it.
trying to be real
Yeah.
with them, you know.
It's a real relationship, isn't it?
It truly is, and that's what I feel like is so hard. I think to sometimes for us is to discover that and to remember that, and that like I'm using myself in this engagement
Yeah.
to model the way that a healthy relationship could be. I'm not
Yeah.
the friend, but I'm a human being in
Yeah.
in a real relationship.
It's a unique and one of a kind relationship, but it is nonetheless a real relationship. What was the second case?
The other was this was a case where this was someone I was seeing when I was at Catholic Charities, and the person probably had a personality disorder. It was very hard. The boundaries again were very hard. But the person found my phone number at home and tried calling me and find out where I live, things like that. It became, but one day, so I had learned in school and actually I learned this from another colleague too, that if I was very conscious of wanting to make sure that I gave enough time to the client, but also wasn't like overextending the time so that the next person and those other things I had to go do. So I kept a clock kind of in the corner of the room so that I could like
Sure.
be attuned to the person, but glance over and see what time it was and not go like put my wrist up
Okay.
so to see, well, now it's what time is it? So the person saw the clock and perceived that as a rejection of him. And I was just flabbergasted by that, and just then wanted to make everything okay for him. And like I don't know if I actually handled it right. It became really kind of a painful thing for me because I got so stuck on myself and what have I done wrong, rather than taking it as a therapeutic moment to talk about what does rejection mean to you and how does this perceive as rejection. And I wish I could go back anyway.
No, I like that. So you're talking here about how a patient's reaction in a moment is really revealing something deeper for them that predates you, that happened in their life, that gets interpreted in a moment, in this case as rejection. Maybe I'm not important, or this really real because we're on a clock. And I think what you're raising right there is we can drop into our own, hey, what have I done? Or maybe even our own shame place of, man, I didn't handle this very well. But those are tough moments, aren't they?
Oh, yes. Yes. And I think that whole thing about realizing maybe, I mean, I don't think that was an error or a mistake to place a
Yeah.
clock somewhere so I could be, monitor the time. I don't think that, but to talk about, like, I think to use the moment as how is this impacting me in a way to get in touch with that a little bit so that I could maybe better reflect that back to the person,
I think
in
that's
the
really
real
good.
relationship.
Well, what you're talking about here is countertransference, where their reaction, back in the day, countertransference was something that was seen as problematic and something that needed to be kind of worked out in your own therapy as a therapist. Versus now, we understand that, in kind of the countertransference pie, if you will, there's our own stuff, there's the complementary countertransference, there's indirect countertransference, there's concordant countertransference. And what you're talking about here is a complementary countertransference, isn't it? Where you're being pulled into an enactment, something where the patient once upon a time had some kind of abandonment or some kind of something conveyed to them about, well, I'm not important to you because you're looking at a clock and we're just on the hour, and who am I to you, and all of these things. And all you're doing right there is making sure that you keep a good therapy hour and you keep a good boundary, but within that boundary these things emerge. And so, but what we can also do is we don't recognize that sometimes in ourselves, and we all get to this place, particularly as young therapists, where we feel like, oh, my stuff gets kicked up and am I not doing this right? And we kind of drop into that, versus what you said. What I like is, hey, what does that mean to you when I look at the clock?
Mhm.
And tell me what you find getting kicked up for you. So we get to use the in the moment kind of therapy relationship, don't we, to find out, hey, what does this mean for you earlier in your life, or maybe even currently?
I love the way you phrased that. I have to say, I feel sort of in my life, I sort of bounced back in quotes from that experience because I had an awesome supervisor. And I think sometimes I know in our profession, we look at supervision like as the graduation day when it's done. That
Right.
like I've accomplished, I can get my license now because of my supervision hours are over or whatever.
Right.
But I feel like that having a supervisor is a unique relationship. It's not just somebody that I run. It's like somebody that I can be real with as well. But then that supervisor for me isn't a friend or really a colleague, but somebody that is almost in a therapeutic sort of role for me. It's been
Yeah.
so helpful. It was so
Yeah.
helpful.
That's really good. I want to stay with that piece in just a moment as we talk about some of the internal experiences that we can have as therapists. But I want to go back over something about this idea where this relationship is a real relationship that truly we have the privilege to have with those that entrust us with their lives. But we know that those that experience a trauma have the most basic trust in their lives typically betrayed somehow. Let's stay with that one, just maybe relational traumas. And their security operation, what you were talking about earlier, really clearly causes them to maybe be cautious or leery or slow to trust, which can impact their ability to bring their trauma up into the conversation or up to a conversational level in the therapy with you, which is necessary for the therapy work to get done. I need you to kind of share and bring things with you. But if trust is a basic issue that's been, breached or betrayed, it's so very hard. When you're working with someone, how do you name and normalize these security operations on the one hand, and at the same time explore how they might begin to take some risk with you or kind of lean into this relationship so they can tell you the story and you can join them in it?
This is going to sound like the old trite kind of, from my perspective, of the unconditional positive regard
Yes.
that which our Carl Rogers
Yeah.
would describe, and just say, I just feel that just, if I can, whatever I can do, my facial expression, my bodily presence to the person, my tonal could just be of acceptance.
Yeah.
And that I'm here. I feel like that it's a challenge, to think about, like, I mean, if I've been brought up and, like, I know that I want to value the human dignity of every single person that comes to me, no matter what the experience is, but maybe I've been hurt or things, or been influenced by things, or have my own bias towards people or a person, or the way a person behaves, or the way a person is. I've got to try to work through that, or try to just, how can I just have that open acceptance and the
Yeah.
recognition of the dignity of the person that's before me, and the challenge that they're embracing to come be with me in this moment.
I love
That's
that
the first thing
frame.
that comes to mind.
I'm sorry, say it again.
That's the first thing that just pops in my head as you pose that question.
Well, I like that. I mean, I could even see, saying something like that of, you're coming here and you're entrusting me with some things. And I'm going to trust that's going to be challenging and also, hopeful for us both. And I'm going to try and show up as best I can, but I so want to acknowledge what you're doing by being here. I really like that. And kind of that, Carl Watch talked about WEG, warmth, empathy, and genuineness. You're hitting it right in the head.
Also, I feel like many people that come with relational struggles or maybe traumatic experiences have been told, trust me, it's going to be okay. You can put your trust in me. And it's been nothing but violated. So it's almost like the word trust becomes a triggering, reactive experience. So how do I convey to somebody, I want you to trust me, and I want you to find trust here? But I feel like maybe, like, it's putting it back in their court to say, look, I recognize your dignity and I recognize your value and what you can do. It's up to you to trust. How can I be a trustworthy figure for you? Like, kind of putting the ball in the court of the person we're working with.
What I love that you're doing right now is what you're saying is, what if we just name these things? What if we just normalize and kind of say, hey, I would imagine from the stories you've told me, all these relationships have been, betraying and trust breaking. And here I am asking you to trust me. Holy cow. And you're saying, bring it up, ask what it's like, and maybe how can we build trust together, if I'm hearing you right?
Yes, yes, yes. I think exactly right. Something else that is sort of tangentially related, but this is going to be geeky for just a second. But, like, I've been reading about this concept of mirror neurons, which are these
Yes.
neurons in your mind, and that how they can reflect what's going on in another person. So I was thinking about this, and I read something about it. So say if I'm in a therapeutic situation with someone, and they're telling me something terrible that happened to them. And if my facial expression to the person is one of, like, shock, horror at what they're telling me,
You bet.
I think in my mind, I might be thinking I'm really conveying that I'm with them and that this was really horrible. But then what the person might be seeing in my shock, horror face is, oh no, he doesn't like it either. This is terrible. So I have to be empathic and listening and be aware that I'm not just like conveying some sort of horror to the person as well, and
Yeah.
that I'm as freaked out as they are. They're going to need somebody that's a steady presence in it. I don't know if I'm saying makes sense.
Yeah, it makes total sense. You're talking here about kind of that part of the countertransference where I understand what they've gone through, but I want to come in kind of a concordant way where I want to come in with empathy. I want to hold the trauma. I want to hold the reaction that they're having with them at their level. But you're also talking about that mirroring process being an essential part of what kind of psychodynamic therapists refer to as corrective emotional experiences. So they've had people betray their trust, and you're saying, I want to be able to be a corrective emotional experience with you. And that can change our wiring here. That can change the patterns and pathways of how, when we have corrective emotional experiences, someone begins to build the very trust that someone took away from them back with you in those therapeutic moments.
Wow, that was really well said. That's great. Thank you.
Well, no, what you're saying though, but it hinges upon that mirroring, doesn't it?
It does.
Both mirroring in our looks, mirroring in our words, holding what they're saying.
Mhm. I know of one colleague that uses the phrase a lot. I want to create a space for this situation, this person. I love that. I kind of like that. I want to
Yeah.
create a space for whatever you want to bring for who you are.
What a great invitation. Yeah, what a great invitation. You have a very nice way, man. You're just you're genuine, you're lighthearted, but you've got this great depth to you, and it's inviting of people just to feel safe. So I really like that. Hey, we've talked, Reagan, about this internal experience using ourselves as therapists. How do you navigate when you're working with patients a mindfulness and an in the moment awareness of what may be coming up for you as you listen to some of these stories? It might be hard. How do you pay attention to that while you're working with the person in front of you? How do you have that dual attention?
I wish that I had a really great answer, because if I did, I think I could write a book and be a millionaire or something. But I know my own experience is like just to like that whole concept of holding space or creating space. I feel like that I'm holding space for the person, but then we're sort of in this thing together where I always tell the students in discussions that I want to lock arms with the client and kind of walk forward together, with the person. And so I just have to recognize that I'm in this with the person. I'm in this with them. And I know, like, there are times when I hear something and that feels painful, or it rings a bell that's painful. And, we use
Right.
those fancy words like secondary trauma or vicarious trauma.
Yes.
But I just feel that if I've got a bigger situation in my life, that I know that in this moment with this person, that I can endure whatever I'm feeling. I'm sure, I know, I've told myself, I know I can endure this
Yeah.
pain or this struggle that I'm having, and be available to this person, because when the person's gone, I can go do my own thing. I can sit quietly by myself, or I could
Yes.
call a friend or call a colleague and say, wow, I've just had a tough time. I feel like it's calling myself out of this situation, but kind of parking it in the parking lot for a minute while I'm able to say, I want to be present to you. I can endure this. I know I can make it through this
I
painful.
really like that. So there is that mindfulness there where you're noticing something coming up and you're naming it for what it is, and you're finding a way to kind of hold it and kind of suspend it or kind of compartmentalize it enough to be present with a person who needs you to show up in that way, knowing later on that you get to come back and maybe process with a colleague or just kind of in your own thoughts. I know you're a runner, so I would imagine some of that's part of your own process that goes on. How do you find yourself being able to soothe yourself in those moments when something's coming up that can be triggering? What do you do just to kind of regulate yourself inside?
That's a great question. I think I have an answer. One time I was giving a presentation to a group, and it was when it was years ago, and I could talk a little fast, as maybe you've picked up, and we get a little hand gesture and that kind of thing, and it exhibited that I was nervous. So I think that the audience was experiencing my nervousness because of my hand movements or my fast pace. So somebody suggested me, hey, why don't you, like, crunch your foot up in your shoe. Just put your energy down there. That moment changed, helped me so much, because I've been able to, I can find myself, it's almost like an automatic thing now that I kind of crunch my foot up in my shoe, and some of my energy goes there so that I can be available to the person, almost like, a duck that looks so serene on top of the water, but their legs are going like that. It's that has helped me a lot. That's just one thing that I've been able to
I really
do.
like that. So that allows you to kind of self-soothe, kind of hold that moment and be present all in one. Yeah, really good. Really good. As I mentioned, listeners too, at the very beginning, Ragan is both, got his doctorate in psychology, but he also is involved with the church. And Ragan, I want to kind of run something by you right here. I believe we are comprised of three parts: our mind and our body and our spirit. And I believe that there are laws that govern the healthy functioning of each one of these. And while all three naturally impact each other, each one needs its own approach or treatment, if you will. The mental health side, the mind side, needs, mental health practitioner. The body side, a physician. The spiritual side, ideally, kind of a pastor or a priest. And the cool part about you've got the spiritual and the mind side, together in one. Being both a mental health doc and a spiritual, side within your role and within the Catholic Church. How do you understand the impact of trauma on one's spiritual life?
Whew. This is something that I just feel that a spiritual trauma or a trauma or an assault coming from a religious, spiritual part of the human's life is such an invasion and such a damaging thing. If you think about it, that I've been brought up, from my early years, that there's an all-powerful God, and that
Sure.
all-powerful God is loving, but then I experienced this opposite of that, or that the thing that's the very thing that's supposed to represent that love and care and all-powerfulness is serving as a violation. It's just so painful to hear and to see. That's just my feeling about
Yeah,
it.
I think that's good. I think when we recognize, and when you put it like that, we recognize our earthly relationships set a model for how we might think about our higher power, whether it's God or whatever it may be. Uh, that sets up how we're going to see that higher power, our God, as kind of an authority figure, if you will, or someone we can go to. So if people will say, well, if my father, kind of breached these boundaries right here, or he's not safe, or he's judging of me, of course my God is going to be that way as well. So that sets up kind of a relational pattern, doesn't it? An unconscious expectation that either we're not going to be good enough, or and it can really interfere with how one spiritually kind of navigates their life.
I too. I think that what you're talking about, I think, is a spiritual component that can be embodied in religion or be embodied in some other yoga or something else. But I love what you were saying a second ago, to recognize that the spiritual part really is a part of who we are, like our
Yes.
any other part of who we are And how do I find that or meet that need? And it's not easy. It's not easy
No.
to figure that out, because I think, like, we were talking in class yesterday about doing assessments. And so, I brought up the idea of spiritual assessment. And so, what would be a good question might you ask in a spiritual, to help the person kind of explore a little bit of their spiritual life? And one of the students said, well, you could ask them, are they attending their church? And I feel like that was such we talked about it in class, and I think the student would mind me saying this, that sort of like there was this expectation, of course you're going to church, and are you following through on this formula of going to church? I just feel like, this may sound funny coming from someone with me with a priest background and all that, that maybe there isn't just a formula. That how do we discover, how do I live in relationship with a higher power? How do I live and recognize the relationship that I have in my life that's spiritual? If that makes sense.
It makes total sense. I think what happens sometimes is, if our psychological relational side of who we are, that mind side has traumas in it, we don't believe we're going to have access to a higher power, or maybe we're angry at a higher power for allowing those things to happen. And that makes it, how can there be a loving God or a loving higher power in this? Also, too, in traumas, and I want to talk about this right now, shame sets up so much of how we see ourselves and how we could even imagine going to a higher power if we have this, this embarrassment and this part of ourselves that is just so dark. It makes it harder to come to a higher power, even if we want to say, hey, no, the higher power is not who your earthly father was. This is a different kind of father or a different kind of relationship you can have. It is so influenced negatively, isn't it, by that
Yes.
earthly relationship and that trauma. Let's shift just a wee bit around this idea of shame. So shame and guilt, we sometimes kind of blend those two together. I'd be curious. I understand shame being it's, shame, guilt is like what I do,
Mhm.
whereas shame is who I am, very personal, like a personal self-meaning. How do you help folks work through trauma, kind of a trauma identity, which is more times than not a shame-based identity? How do you help them move through that to get out of the shame and to recognize what really happened to them is not about their fault or who they are?
We could talk for hours, months about that topic. It's so huge. I feel like that when we look at the way how I look at it is that like that Erik Erikson has these stages of development that I'm sure you know,
Yeah.
that like the foundational prior to guilt is autonomy versus shame. It's just
Very
so
good.
closer to the core of
Very good.
who we are. And
Yeah.
then later the initiative versus guilt comes along because it's more like another layer that's built about what we do. So there's this who I am and then what I do. That's how that kind of develops, I think, as a human. So I think it goes back to, and I think like part of the autonomy versus shame and that trust versus mistrust, those early elements of our human life are about attachment and connection to the parents that or the caregivers that we have in our life. If you think about it, when we're a little bitty baby, we're kind of crying because we're hungry, and then a primary caregiver could look at us and say, "Oh, I get it. You're sad. I'm goo goo. You're sad. I see how that is." So the baby's thinking, "Wow, somebody gets me, and my feelings are validated. I'm okay. They're affirming that I'm crying because of a legitimate reason." But if maybe adults in the infant's life early on don't validate that and don't meet the need and don't whatever, then I think then that just helps the shame sort of foster or that like, wow, I'm crying but nobody cares. Maybe my feelings aren't really, nobody
Very
gets me.
good.
I don't
Very
know if that
good.
makes a lot of
I
sense.
really like that, because what you're talking about here is we think trauma always has to be the 9/11s, the big T traumas, the assault, the car accident, and they don't. They can be relational injuries where a child in a moment of need, kind of in that trust versus mistrust um, place, can begin to realize that people don't respond to me in my life. Or they respond harshly, maybe just with a, kind of a cross look, or just a kind of a gesture, or a kind of thing where they just, and what a child begins to do with that, they begin to develop a meaning about themselves. They can be shame as, I must not be of worth for my parent to respond to me. I must not be important, or maybe I'm not enough, or maybe there's something about me that's flawed. And little do we know, but that whole mindset begins to develop, doesn't it? So it doesn't have to, and I love what you're saying. It doesn't have to be the big traumas. It can be what we refer to as little T traumas. Again, as we talked about in prior shows, no less injurious and no less significant, but they're a little more subtle sometimes because they occur in relationships. But they're just as impactful, aren't they?
I truly believe so. I think that earlier when I said the thing about that flood deal, of how
Yeah.
that's that there's also like just the drip 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 of just
Yeah.
water, that does equally damage. I have some friends at their home. There was something upstairs. The water burst and it just destroyed the house, but it wasn't like it was just drip drip drip. It
Yeah.
was terrible.
Yeah.
And also, I want to kind of say a thing here that like I feel like that when someone, if they're because of their gender or their race or their sexual orientation or their gender identity, that like if you've gotten this message from early on that somehow you're not good enough or not quite up, your body begins to adapt to that, and it's fight or
Yeah.
flight experience there. But I feel like that's a developmental process, and I feel like as a society we've got to reckon with that, on those issues.
That is really good. That is a personal and kind of branches out into the societal level, doesn't it? That is very true. Hey, I know we're kind of coming to the end of our time today, and as we kind of come in here, let's talk a little bit about termination. We are in a therapeutic relationship with somebody, and what we're looking to do is to work to a place where we can work to kind of a therapeutic ending, a kind of a therapeutic goodbye. How do you do that, and how do you even think about that, or even introduce that, as you know you're beginning to coming to a close? How do you talk about termination?
I think there's all these conflicting feelings that can rise up. I know in me, like especially I've invested in this person, I've invested in this relationship, but it's time to go. It's time. And I think some of it, as long as I've already mentioned Eric Erickson, I maybe might refer back to, that like I feel sometimes maybe parents in a parenting relationship, if a child goes off and tries to do their own thing, but then maybe the parent might be too worried or too nervous, then they want to keep the child. Oh no, you can't do that on your own. So then that creates some sort of shame element in a child, or could.
Yes.
And I think that the same thing could happen in a therapeutic relationship. That my message is that you don't need me. I've been a great tool or a great part of your life, but you can do this. This is your time. You can make this happen. You've learned and grown in a lot of ways here, and I don't want to create shame and dependency or whatever on me. I want to create you as a person that can go and implement the cool stuff that we've explored.
So really, when you put it like that, almost like the good parent who is selfless, you have the relationship that has early on dependency qualities to it. Of course it would, because they're building trust, they're trying to explore themselves. You're there in that kind of therapeutic way. But then as they kind of mature psychologically and within themselves, it's a place where they get to kind of, like a parent, kind of launch their child. You're giving them wings, and they develop their wings and grown them with the potential that's inherently there. You just kind of help foster some of that. So this whole idea then, as it begin to wind down, you get a chance to kind of honor and respect the work that was done in the relationship with you, but at the same time saying, hey, you're ready to launch.
I think maybe another analogy might be, like if I don't know if you've ever been a swimmer but learned how to swim, like that side, the side of the swimming pool becomes your friend, and then then you kind of swim out a little bit, but then you have to come back. You maybe swim out a little bit, but you want to come back. But eventually, you learn how to swim on your own, and you can swim the whole lap or whatever on your own. And what a great thing that is! What a great talent you have to be able to do.
It's fun. It's fun to celebrate that, isn't it? To look back and say, hey, look where we started, and look what you've done. And look what, your level of competency and mastery in these things, and how much confidence you can have coming into the world now. Good for you, and I'm always here. You can come back, and sometimes I look at it, when you first come in, you do some really good work, you lay a foundation, you build kind of the proverbial great single family dwelling. And then later in your life, you might want to come back and add a room, or kind of grow in different areas, and maybe your life changes. And so you add these things on, they can always come back anytime. So, hey, Ragan, as we do come to a close today, give us some resources that you might like our readers to take a look at regarding trauma, your trauma-informed care program, your schooling, things about you. Give us some resources.
Well, I think the first thing I have to say is our team at the College of Social Work have developed this postgraduate trauma treatment certificate that you can find at the University of Tennessee's College of Social Work website. And there's 3 big modules. You learn about neuroscience, theory, and practice. So it's a great thing. And then something I'm really not connected to at all, but have certainly benefited from, is that brand new book about what happened to me, which is Bruce Perry and Oprah Winfrey have got a book, and it just in very accessible ways talks about trauma and many of the things that you and I have been just talking about today. And then, of course, the Vanderkolk book, The Body Keeps the Score, I think is another great book. In fact, just the other day, I asked someone, hey, you should check this out. And just really has been an insight-filled
Really
experience
good.
to read that.
I appreciate those resources. And just for our listeners too, just so you know, you can find all of our resources that we've had from all of our shows, including the ones that Ragan are giving us today, at triadhq.com/behavior/health/today. So feel free to go on our site. Tremendous amount of resources for a variety of clinical problems and issues that we can have. So some really good tools there. Ragan, my friend, it's so nice to have you on the show today. Thanks for all your input and what you bring in terms of your spirit and your energy and your insight and awareness in these things. Thank you. Thank you so much for imparting that to us today.
Oh, thank you, Graham. You're just great. I feel so at home and comfortable talking with you, and then getting to listen to you when I hear the podcast. Thank you so much.
Well, it's great to do it with you. And I want to thank our listeners for joining us today. We always appreciate it when you drop by, and so appreciate your listenership with us. We'll look forward to seeing you next time on Behavioral Health Today.